7 questions to ask your doctor about your stroke. Take control of your recovery. When a stroke happens, it's so sudden and unexpected that it can feel surreal. You can't be blamed if your first thought is, "This can't be happening to me." Your life is turned upside down because you can no longer do the simple things you took for granted before. You may feel out of control and afraid. Recovery can be a long and ongoing process. Progress may feel frustrating slow, and there are long stretches in between appointments with your medical team that surely could be used more proactively. And when you have a question that you want to know more about, it can be hard to get access to your medical team outside your planned appointments, not to mention that physically getting to those appointments can be a drain on your energy reserves. Question 1. What kind of stroke did I have? You'll feel more positive, energized and in control of your recovery. Stop being a stroke survivor and become a stroke thriver. Strokes are categorized into 3 basic types. Types of human brain stroke: hemorrhagic, ischemic, atherosclerosis. A buildup of plaque in the blood causing a disruption of the blood flow to the brain or a blood clot that blocks a blood vessel is known as an ischemic stroke. About 4 out of every 5 strokes fall into this category. Because the main issue is blood flow, medications are focused on either thinning the blood, to prevent additional clots from forming where they should not, or addressing excessive amounts of plaque in the blood. Strokes that are caused by the breaking or leaking of a blood vessel in the brain are called hemorrhagic strokes. When this occurs, blood can leak into the brain, effectively stopping the flow of oxygen and nutrients. Long-standing high blood pressure and aneurysms, or thin spots on the blood vessel wall, can lead to a hemorrhagic stroke. Treating this type of stroke may sometimes require surgery to remove the faulty blood vessel or to strengthen it from the inside. Sometimes referred to as a mini-stroke, a transient ischemic attack, TIA, lasts only a few minutes or a few hours, then the symptoms subside. Even though the symptoms of a TIA are similar to a stroke, many people ignore them. However, 1 in 5 people who experience a TIA may be at greater risk of experiencing a second stroke in the near future. Treatment is focused less on the symptoms and more on preventing a second TIA or major stroke. Since the treatment approaches for each type of stroke vary, having a doctor's explanation of the type of stroke you have experienced will help you better understand the recovery process, the medication you will be taking, and their potential side effect. Question 2. Where in the brain did that happen? It is no secret that neuroanatomy and physiology are complex sciences. However, Advances in digital imaging of the brain over the last decade have enabled doctors to pinpoint the parts of the brain that are associated with different functions. Occipital lobes are where sight information is processed. Strokes affecting this area may cause blindness. Frontal lobes of the brain are located just behind the forehead and are responsible for learning, thinking and knowing. They also affect voluntary movement like walking, sitting, standing, and running. The prefrontal cortex is located next to the frontal lobes and affects a person's personality. Strokes affecting this part of the brain can cause dramatic changes in the way a person interacts with their environment. Broca's area and Wernicke's area are located in the left side of the frontal lobe and are responsible for speech and language, respectively. Understanding the part of your brain that has been affected by a stroke will not only help you understand the symptoms you are experiencing after the fact, but it will also help you formulate an effective plan for recovery. Question 3. What caused it? Knowing what caused your stroke will greatly impact the way you deal with your symptoms after the fact. High blood pressure is the #1 risk factor for stroke. Maintaining a healthy blood pressure through diet, exercise, and medication, if necessary, will, in turn, reduce the likelihood of having a stroke. If your stroke was caused by a blood clot, your doctor will likely prescribe medications as a first line of defense to keep you from forming additional clots. Because blood clots can occur for a number of reasons, it is likely that further tests and scans will be needed to get to the source of the blood clot. If the stroke was caused by excess plaque in the bloodstream, treatment will focus on reducing the cholesterol levels in your blood. Taking the time to understand the cause of your stroke can impact your physical treatment as well as your psychological well-being. When you understand the causes you can mitigate by the things you do, you begin to regain a sense of control over your body. Question 4. Which of my functions are impacted? Your focus in recovery is likely to be getting back to normal. Understanding the functions that are impacted by the stroke will help you begin to understand what your new normal will look like. Many people who have had a stroke experience changes in speech and language, their ability to learn or recall information, walking or balance, and personality. Intensive rehabilitation, medication, changes in diet, and time can improve many of these functions, but understanding the impact of your stroke will help you appreciate the progress you make. Mood. Up to 2/3 of people feel depressed at some point in time after a stroke. Communication. People often have difficulty speaking, understanding others, reading, writing, understanding body language and gestures. Nutrition. After a stroke, there is a higher risk of poor nutrition due to not getting enough nutrients through eating or drinking. Fatigue. Many people feel a constant weariness that is not made better by rest. Incontinence, control of your bladder or bowel, is often affected by stroke. Mobility, a stroke can affect parts of the brain that control your arms and legs, resulting in paralysis or weakness. Pain, central post-stroke pain, CPSP, headaches, and shoulder pain are common. Sexuality, stroke can affect your sexuality and your self-esteem, how you see yourself and your relationships with others. Perception, stroke can affect your thinking and perception, including what it sees, feels, smells, tastes and hears. Vision, about 1/3 of stroke survivors experience vision loss. Question 5. Who else could I see to improve my recovery? While physicians are the first line of defense in the recovery process, other specialists can have a profound effect on the recovery you are able to achieve. Physiotherapists treat muscular pain with massage, heat, and exercise. These specialists can offer assistance with retraining your arms and legs to do what you want them to do. Neuropsychologists understand the relationship between brain function and personality, behavior, and learning ability. They not only help caregivers understand how the stroke has impacted your brain, they can also assist you in recovering your ability to learn, think, and interact with others. Speech-language pathologists are specialists in speech and language. Not only can they help you regain your ability to communicate, they also assist patients with swallowing difficulties that may result from a stroke. Occupational therapists can help you develop or maintain a satisfying routine of meaningful everyday activities that can give you a sense of direction and purpose. They help these patients develop, recover, improve, as well as maintain the skills needed for daily living and working. Psychologists provide assessment and therapy to clients, help facilitate behavioral change, or administer psychological tests to individuals or groups. Question 6. What help should I ask my family and friends for? Your friends and family will want to help, but often will not know what to do. Depending on the area of your brain that was affected by the stroke, you may need assistance with basic functions such as showering, brushing your teeth or hair, and dressing. You will likely need help with transportation to and from appointments with your physicians and specialists. You may even need assistance with grocery shopping, meal preparation, or cleaning your home. These tasks are all ideal ways for your family and friends to assist you on your road to recovery. If you cannot be specific in your care needs, designate someone to match willing helpers with needful tasks. There may also be organizations that can help with tasks like cleaning and cooking meals. Ask your doctors or nurses to refer you to a support services organization near you. Question 7. What symptoms should I look out for in the future? 4 in 10 people who have a stroke go on to have a second one within 10 years. Recognizing the symptoms of a stroke can lead to immediate medical help and help minimize the damage done to your brain. The easiest way to remember the signs of a stroke is to think of fast. Face: has your mouth dropped on one side? Arms: can you lift both arms? Speech: is your speech slurred? Can you understand what people are saying to you? Time is critical to preventing permanent brain damage.